So, welcome to orientation on what you should be aware of as you get to start your third year medicine. So, with medicine, however intelligent you are, I know we are sharp, I know we've been making it and such, but you will not be able to manage going alone. At least this one, I can tell you at the beginning, you can't start studying medicine alone. No, I've started studying because no, it's not possible because you'll not know what to pay attention to. That is because there is vast information that you have to know. And so the only way you are going to get started smartly and well is if you know what to pay attention to and what you're supposed to be looking at. So basically that. Starting with the courses that we are going to have next year in third year medicine, are going to have 6 courses: microbiology, pharmacology, pathology, neurosciences, clinical skills, and then there's epidemiology, research methodology, and biostatistics. I've not put the course codes because if you are going to be with the fourth years, then the courses are going to be, you are going to have 2 course codes. So normally microbiology is going to be PTM 3520. Pathology is also PTM. So micro is PTM 3520, pathology is PTM 3510, and pharmacology and neuroscience, these are PGYs. So pharmacology is PGY 3310, while neurosciences is PGY 3320. And then on these clinical, the DME and epidemiology, research methodology, and biostatistics, this is DME. So DME and another DME. The epidemiology is similar to the DME that we've been taking, and this one will continue until medicine finishes. In first year, there was DME. That's the same DME that you did when you went also for your clinical research, the same labs that you had. And they said DME again, that will continue, and it will continue going like that in medicine. So we are going to talk about each one of these courses so that you just be able to know how you are going to be able to handle them and how to go about them. Starting with clinical skills. So clinical skills, each week you are going to be having sessions. You are going to have a session where you are going to be going to learn by the skills lab, and then you also have another session where you are going to be going to practice. So say you go on Monday for your session for learning, and you do history taking, out to take a history from a patient. And actually that is going to be the first one that you are going to do, history taking. History taking is very important because after you take a history of someone, history is you are trying to see, a patient has come to you complaining. Let's say the patient has come complaining that they have got headache. There are a lot of things that can cause headache. Or let's say, for example, someone has come and they are saying they have got pain in the chest. There are a lot of things that can cause pain. So, what you want to start in clinical skills for you to find out what is really wrong with them is, the first thing you want to be able to find out what we call demographics. Where does a person, the information about the patient. So that will be the first thing you'll be asking them about. What is your name? What is your gender? Of course, even if you've seen that, you you know how to ask the question, but some they've come in a sketch, but people would want, even when they've come in a sketch, maybe for them they are males, or some males they've come and for them they are females. So I want to ask them, can I call, maybe you can ask them politely, can I call you Mr. or Mrs.? That is finding out about their gender. Okay. And then you want to ask them about where they live. You want to ask them if they They traveled, but basically demographics is specific information about the patient, their name, the you get their details about where they stay, you get their details about what they do really, their occupation, what they are doing. So such kind of information, you get the information about their religion and such. The aim is you want to see what kind of person you're interacting with. You also want to ask them what language they're comfortable with using, and you also want to ask if it is the first time they have come to the hospital. Actually, you want to ask if they went to another hospital before they came there. That would be the basically the general on the demographics or the information you want to find about. And then you are going to go now to what we call the chief complaint. Here, this is why I was asking the patient is what is wrong with you? What has brought you to the hospital? So they will tell you, I have got pain in the chest. You want to ask them again, is there anything else that is wrong? They will tell you, and then you ask them, what is the period? How long has that been? So it's very important to ask that. And these are the same things that will be coming in your test and in the exam. And then you are going to go to what you call the history of presenting complaint. So you want just to make sure that the problem that you have seen that your patient has, you break it more. Okay, you break more the problem. If they say they are having pain, there is a mnemonic that you are going to use: Socrates, Socrates. So it means something. The S will be site. Where is the pain? Can you point to where the pain is? The O is the onset. When did the pain start? The C is the character. How is the pain itself? Okay, sorry for that. So the C I said is the character. I want to ask them how the pain itself is, and R is radiating. Is the pain going anywhere, right? And then the A is going to be alleviating factors. Is there anything that you do that worsens the pain, or anything that you do that makes you feel better? And then the T is going to be the time. When do you experience the pain? And then you want to ask them on a scale of 1 to 10, how bad is your condition. So these are general information that you want to find out in the history of presenting complaint. And then you also want to find out about chief complaints, B symptoms. B symptoms, these are symptoms that are associated with many diseases like night sweats, fever, those things. So generally that is going to be your clinical skill. So if today they teach you, the next time you are going to have a practice session where you are now going to someone will be acting as a patient, you'll be talking to them. And of course, it at the beginning you'll not be too good, and some of your because the people that will be helping with this course are actually students. So are going to have academic assistants. We call them AA, academic assistant. So those academic assistants will be helping with these courses. And the thing is that sometimes they can be a bit harsh on you. They expect you to know everything just at the moment. So it might not be too good, right? It might not be too good like that. So it might be a bit uncomfortable. And one thing that is important is as you go for your sessions, make sure that you are smart. For males, you are always in a necktie, you have tucked in properly, otherwise you will not be allowed to attend that session. For again, you want to make sure that you have all the instruments. So you need a stethoscope, a patella hammer, you need a pen torch and a measuring tape and a watch. So without these, you can't be allowed. If you don't have a watch, they'll chase you. Okay, make sure that you have these instruments, and you'll be going with your ID. So make sure that when you open, you quickly get your ID. But at the beginning, they might allow you to use your old ID. Make sure you don't leave your ID. Should always be hanging in your neck. So meaning you are always smart like that. At the end of the sessions, they'll be giving you sometimes writing assignments, sometimes reading assignments. What you want to do is make sure that I know you time will seem to be a bit of little, but make sure that you do the reading assignments. Read them. Even just go through even for 10 minutes. It's worth it. because it's those same reading assignments and writing assignments. Sometimes you'll be exhausted, you just be copying from people you submit. But actually, they are the same things that will be coming in your tests and the exam. It's a very easy and direct course, but if you don't take those reading thing assignments seriously, they'll cost you. It's the only course where you can get an A plus because it's direct. And when it comes to the assessment, you are going to have two OSCE exams, OSCE or SCE. That's OSCE. So this is where you'll be the same practice sessions that we are having. There is a patient in front of you, and then you're asking them questions. You want to find out information from them, what might be wrong with them. Those are the same things that you'll be doing in those OSCE exams. And normally you are going to be having four, I mean, eight things to be able to do in each OSCE exam. Because the procedures you'll be doing will be a lot, maybe after you do the first 15 or the first 12, you are going to do the OSCE, first OSCE exam, and then you are going to do the second OSCE exam somewhere later on. That will be your test 2 OSCE. And for these, history taking is always going to be there. And it's the first thing that you are going to do when you start doing your sessions, history taking. It is always there. In test 1, OSC is going to be there. In test 2, OSC is going to be there. And then you have got what we call the major exams, GIT, respiratory exam, and cardiovascular system. So these are also major exams. You need to know them. In test 1, they are going to be there. In test 2, they are also going to be there. So sometimes, maybe in test 1, you are going to have respiratory system and the cardiovascular system. So you can have any two of these, not all the three. You can have any two of these, and then you are going to have now some other minor exams. But these three are a must, they are very important. So basically, that is going to be about your clinical skills, and then you are going to write your test 1 theory, your test 2 theory, and then you're going to have the final exam. So that is going to be the general arrangement of the clinical skills. Is there any question on clinical skills? Yes, please. So the OSCE exams carry a lot of marks. Yeah, the OSCE, where you are doing the procedures, they carry a lot of marks. So you need to make sure that you can do the OSCE exams very well. They should carry like 30. Each one of them should be like a 60, unless they decide to change. And then now you're going to have the test 1, the test 2, and then the exam. So you see just the OSCs are the ones which are carrying a lot of marks, even more than the theory final exam. Is there any other question? On- So the format for the tests, you are going to have, mostly it's writing for the tests. For example, they are going to ask you what is the process, write all the steps in order that you follow when you are taking a history. So you say the first one is demographics, the second one is chief complaint, the third one is HPI, history of presenting complaint, the fourth one is review of systems. So there are 10 steps that you have to follow. So you just list them in order, they give you marks. They can even show a camera instrument because you are going to be dealing with a lot of instruments in the skills lab. Let's say, for example, they'll capture. If you want to measure the height of an adult, what do you use? There is a ruler that we use, but we don't call it a ruler. It's known as a stadiometer. So they can just bring a picture for that. And for babies that are just born, you also, when you want to find out their height, or can I say length, since they'll be down, there is also a certain instrument that you use. It's known as infantometer. So they can also bring those. In other words, you should be able to identify the instruments that you will be dealing with in the clinic. They can as well bring those. And also the same reading assignments that they're going to be giving you. For example, the same things, simple things like the ones you've done in anatomy, the location of the appendix, the McBurner's point. If you press there, if someone is feeling pain, what is the meaning of referred pain? You describe what referred pain is. What is the meaning of rebound, tenderness, such things. The same things that you'll be doing in the clinical skills. For the exam, in the recent past, they've been bringing a lot of questions with true or false. But for the previous exam, it was basically writing, and then there were only a few, like 10 questions where you should put true or false. So it's a very easy test for the clinical skills. But it shouldn't be taken for granted because it frustrates people because the entire academic year they've been taking it as an easy course. So when the pressure started, they fail to manage it because even if it's an easy course, you can't do it just at once. That's why people end up getting frustrated because all this while they've been taking it as an easy thing, so they've not been even revising the reading assignments and those simple things. Is there any other question before we move from this course? So the instruments, you need a stethoscope. You don't need to get something that is fancy since you are not yet a doctor. You can just get something that will keep you going for the academic year. They are not too expensive. If you get them even say in town, you find somewhere 100 kwacha or something. So you need the stethoscope, you need a patella hammer, you need a pen torch, you need also a measuring tape, a watch. Yeah, these are the basic things that you need. Any other question? So that is that about clinical skills. The second course is epidemiology, research methodology, and biostatistics. So as you can see, this is actually a three-in-one course. There is epidemiology. This is where you'll be basically studying about how diseases are distributed, what you can do to be able to manage those diseases, and how you can help the environment in order to be safe from such diseases. And then you'll be doing research methodology. This is where you basically want to understand if you want to perform a research, whether an academic research or any kind of research, what are the procedures that you follow for you to make a good research. Actually, in this generation, if you want to make more money, you should be good in research because there are a lot of things that we need to find out. There are some diseases that are just coming out, and how are we going to know the medicine? So you need to be able to engage in research. So it's a very nice course, and you make a lot of money. Being a doctor alone will not give you as much money as someone that is doing research. That if you find out the rich doctors that we have here, try to find out the rich doctors that we have at UTH and find out what they do. They are involved in research. It generates a lot of money. You'll be able to travel the world because of research. In biostatistics, you want to understand the use of mathematics in being able to also perform a research. So you are going to be dealing with basically statistics, calculations, and there is one question that you always need to know because it will be there. It's about proving that, when you are carrying out a research, because your population is very big, you want to just deal with a sample, not the entire population. So from that population, you just get some specific people, and those are the ones that you are going to use to carry out your research. So there is one question where you'll be proving a very nice formula. So that formula, you just need to know it, or you know it sooner than later. And in this course, you are going to learn it. There's going to be a break in the not really somewhere in the middle of the year, not necessarily that far, but April, May, June, you have a 1 month vacation, but you'll not go home because you'll be learning this course. So it's just taught for 1 month and then you forget about it. They will give you now a test one later on. Maybe they can even give you test two if they want. So this year there was only one test, and then they gave also assignments and then the exam. So just that. So you just learn it for 1 month. You'll forget about it. That's why it will become a bit tricky when it comes to the exam, because you'll now be going back to something that you forgot some time back. But it is easy because you can just use Assidious Academy videos for the previous year. They will really help you on some high yield topics and the past papers. Like the final exam, they just brought the test one and some other few questions which were shared. So it's not much. If you can just review that, they'll help you to clear the course direct without much trouble. Any question on this course? Any question on biostatistics, epidemiology, and research methodology? Okay. So the next course that you are going to have is going to be pathology. So the doctor that will be teaching us pathology is actually here, Dr. Isha Mwaba is part. I'm going to give him time to talk about pathology also. So in pathology, pathology is going to have three components: general pathology, hematology, and systemic pathology. General pathology, you start with cell injury. What happens when you put a cell under pressure? It can get tired, it can give up. How does a cell that is injured respond? So we'll be talking about apoptosis and necrosis and the steps involved. You also have some other general questions from general pathology, general topics, from general pathology, like how you classify cancers, what happens when you, things like hemostasis, basically like hemostasis, the blood clotting cascade. You talk about hypersensitivity, the same things that we did in your immunology second year. So you will review those things. Hematology is you talking about blood and the disorders that affect blood. You know that blood cells come from the hematopoietic system, which can go into the myeloid progenitor or lymphoid progenitor. And it's from the lymphoid where you have got B cells and T cells. From the myeloid, you have got platelets, you have got red blood cells, you also have the neutrophils, basophils. So there are a lot of diseases that can affect the blood system. You have got anemias, that is a decrease in the number of red blood cells. You are also going to have cancers that affect these blood cells. For example, leukemias, cancers of red blood cells, lymphomas, multiple myelomas. So those are the things that we'll be talking about. Basically, you divide the hematology into anemias, lymphomas, and leukemias. These will be the biggest components of hematology that you are going to understand. Then you are going to have systemic pathology. I've even left out one here. You are supposed to have four components. There's also chemical pathology. So on systemic pathology, you'll be talking about, now you start reviewing all the systems from the GIT, all the infections that affect the GIT, starting from the esophagus. What are the diseases of the esophagus? The diseases of the stomach, diseases of the small intestines, or the large intestines. And then you go to the respiratory system, the endocrine system. So you review all the systems and the diseases that affect each system. Chemical pathology, you'll be talking about what are the procedures that you can use in case someone has got a problem. What are the procedures that you can take in the lab for you to be able to find out the problem that someone has? So, for example, someone has got a cancer of the liver. So what are the things that you can look at for to find out the cancer of the liver? So you can perform what we call the liver function tests. So you'll be looking at the liver enzymes. If the enzymes that you're supposed to find in the liver, start seeing them in blood, it means that problem with the liver. So elevation of liver enzymes. You look at the renal function test. That is basically chemical pathology, and you also get to review the same physiology that you have done, like the physiology of the endocrine system. You'll be talking about the adrenal gland, the thyroid gland in chemical pathology. So it is, you can see how easy it is. Actually, general pathology, it's not that hard. Okay, especially if you've not forgotten your physiology, you are going to enjoy your pathology because you're just adding up some few diseases on top. You need, the course is very long because I've said it has got 4 components, and the problem is sometimes you can see today someone comes to teach hematology, next time they come to teach chemical pathology, and the other time they teach hematology again. So it is a bit confusing, and if you don't know how they are arranged, it will confuse you and it will be very hard for you to read. That is why you need to make sure that you know, what am I doing? What topic, this topic, where is it falling? How do I handle it? Because it can be confusing like that because it's long. You need to know some high yield topics because the course is very long, and the way pathology is, for the exam, for test one, you can have some multiple choice questions, even test two probably, but the exam is only essays throughout. So that's why it isn't a too much good course. This year they were 12 essay questions and no choosing, write everything. So you need to know the high yield topics. And some of the high yield topics that you can even be interested in writing now so that you remember later on. Leukemias, you need to make sure that you know leukemias. Anemias, you need to make sure that you know them. You need to know that you need to make sure you go through your endocrine pathology. At least these are high yields. Also, there is Parkinson's disease. It's also a very high yield topic in pathology. Also, a very high yield topic in neurosciences, Parkinson's disease. So these are some of them, but the others will be mentioning them as you get to learn because they might not make sense now because you some of them you do them later on. There is also a book known as Cape Town. It is a very high yield book. Majority of the questions that they bring, they'll just get them from this book. For every year, that's how it is. They'll just get direct from this book and then bring. So even when students know that they go through, but others they feel it's a joke, they don't go through them. But yeah, it's been like that. They've been bringing questions. Even this year, they brought a lot of questions from there. So you need to make sure that there are actually specific topics that come from this book because the book doesn't cover all the topics. I don't think it covers all the topics on hematology. So there are specific topics that it covers. Things like diabetes. Diabetes, you really need to know it. We also have another topic in chemical pathology, acid base. You need to know it. Is also is part of every exam. I have barely seen an exam where acid base balance is not there. So those are some things that you want to take note. And the questions like on acid base balance, all of them they just come from Cape Town. So you want to make sure that you go through past papers as many as you can because the topics are long and the topics are a lot. So if you go through past papers, they'll actually also orient you on which topics are they bringing more. We've uh, we've actually already solved most of the past papers, so you guys are going to really enjoy. We've solved already 2018 past papers, 2020, 2021, 2022 past papers. So you really enjoy because you'll just be revising that and you will see that all the questions are basically the same. And the same questions that we solved in 2020, 2022, they're the same questions that came in the exam for this year. So you see, past papers are very vital to revise. As long as you are reading without going through past papers, you are joking because you might be reading a lot of things that are not sensible. Another topic you need to make sure that you know which is high yield. I've mentioned, hope you've taken note of that. I've said acid base balance is very high yield. Diabetes, endocrine system, like the thymus, the adrenal glands, so endocrine. You also have the cervical cancer is very also high yield. Breast cancer is also high yield. You need to make sure that you know that leukemias, anemias, Parkinson's disease, which is part of the neuropathology nervous system. So these are high yield topics you appreciate. At least if you know these for an exam, it won't be too bad other than someone who knows majority of the others out of these. They are more likely to lose out. Is there any question on pathology? Yes, please. Oh yeah, so the others you are going to be able to see they also depend on who really taught them, but apart from the endocrine, it comes majority of the times. You also have the GIT. There are specific parts that they like picking. Yeah, like for example, the liver cancer. We talk about what is known as a hepatic encephalopathy. You see it in most of the papers. So that is also so because these other topics are really long, they'll just pick some parts of them. Some parts of them. Things like breast cancer, cervical cancer. That is cervical cancer is coming from the reproductive system. From the reproductive system, that's the one that they really love the most. And then you are having the cervical cancer. The respiratory system also want to make sure that you understand what we call the chronic obstructive pulmonary diseases, bronchitis and emphysema and asthma. These are also very nice high yield topics on respiratory pathology. So those are also high yield. Yeah, the others will be able to mention them in the process as we get to go so that they will not frustrate you really much. Is there any other question in pathology? So I'll still ask the doc who will be teaching us pathology to talk about it a bit. And then we are also going to have pharmacology. Pharmacology, just like pathology, you need to know your physiology if you want to understand these courses. Trust me, if you forget physiology, these courses are going to trouble you. They will not be too good. So in pharmacology, you want to understand basically, you are going to have general pharmacology, systemic, and also what we call general topics. In general pharmacology, you're going to start with what is known as pharmacodynamics and pharmacokinetics. So you really enjoy the course, like just the first topic, pharmacodynamics and pharmacokinetics. You go in the exam. It will carry at least you know that at least 20% of the MCQs are coming from just the first topic. Actually, also the just introduction to pharmacology, where we'd be talking about the definitions, what is pharmacology. It's also high yield. Like I shared the PDF with you people where I put questions. There were some questions at the end. There are the questions that came in the previous exam if you saw the PDF that I shared. So don't want to take anything for granted. You are also going to have systemic pharmacologists who will be talking about all the systems. You go to the blood vessels, you go to actually you are going to start with the respiratory system, you go to the GIT, the blood vessels, you'll be doing the muscular system, the endocrine system, the drugs that work on every disease. You know how many diseases we have? We have got a lot that affects every system. So meaning that you are going to have a lot of drugs that you have to be knowing, a lot of them. But again, you have got high yield things that you should never forget. Things like diabetes, because they are common in our society. Things like diabetes, asthma, peptic ulcers. These are common, and so you expect them to be common. HIV, but you also have antibiotics, antivirals, antifungals, antimalarials. You know, malaria is very common in our community. So the common diseases are common, and so even their questions will be common. Dr. Chidumayo is the course coordinator. She's a very good woman. So every question that she gives you, please don't take it for granted. She's simple and she's direct to the point. She will tell you, I'm bringing this. I want you to know this. Why should I hide it if it's the one that you're supposed to know? She's as simple as that, and that's what she's going to bring. Actually, she has got a link where she posts her questions. The thing is, nothing is hidden about her. The same link where she posts her questions, she will post her questions, and those same questions she'll bring in test one, she'll bring in test two, she'll bring in the exam. She doesn't hide anything, she doesn't change anything. It is all direct. So we want to make sure that you are familiar with that. We actually have all the questions from Dr. Chidumayo. They are there. You are going to find them also on the drive as you get to start. So these are very high yield. Please, I'll again say, unless she stops being the course coordinator. But as long as she's a course coordinator, she has made pharmacology very easy, because in the past, what it used to be easy, you need to master every drug. If they say, what drug do you use for this condition, you master it, you just say it like that. But for she has made pharmacology easy because she wants you to understand how a drug works. If you that's known as mechanism of action. So if you understand the mechanism of action, then she will give you the drug, and then she will put in the brackets how that drug works. So like that, it's now not the issue of mastering drugs, but knowing how drugs are working. For example, asthma. When you are treating asthma, you need to know first the physiology of the respiratory system. That's why without physiology, pharmacology and pathology will be hard. So the respiratory system, the trachea, the bronchioles, they'll start becoming small and small. The reason is because maybe there is an allergy, so there is inflammation happening, so there is bronchoconstriction. So now you know the physiology. Okay, bronchoconstriction is what causes asthma. So we call that as pathophysiology. What is causing the problem? Because physiology is looking at the normal function, while pathology is looking at a disease. A pathology is a disease. So now that you know the problem for asthma, it is the respiratory system becoming small. Drugs that you should give should either be the drugs that are preventing the allergy. So remember, allergies will be because of the mast cells breaking and then releasing the histamines and those things. So you are looking at drugs that will stop the release of histamines, drugs that will cause the respiratory system to be big, get bronchodilation. So if you know that, it will be very easy for you to be able to answer questions. So that's how pharmacology is. Not a bad course. If you understand the physiology and the mechanism by what drugs can work in order to deal with that problem, it will be very easy. You find pharmacology to be way, way interesting. So I'll be taking you guys in pharmacology there. So we'll have a very beautiful year together. Is there any question on pharmacology? Is there any question? Okay. It's also a very long course to say. And then you are going to have microbiology. Now, microbiology has got four components. You have got parasitology, bacteriology, mycology, which is also known as fungology. You are looking at fungi, virology, where you're looking at viruses. So, parasites, bacteria, fungi, viruses. If you look at the pharmacy students, microbiology is a different course from parasitology. But you can see, and they actually speak only specific topics from the parasitology and only specific topics from microbiology. So your course is very, very, very long. Okay, very long. So you need to make sure that, and the thing is that you'll be expected to master very small things which are even more similar. For example, parasites, you're actually going to start with amoebas because that's how it will be divided. Parasitology, when you're talking about parasites, you'll be talking about, you split them into the amoebas and these other things. So when you go to the amoebas, you start breaking them. So the thing is that you're going to have a lot. You want to know their the diseases they cause, how you can treat them, and also how they cause disease, and also their morphologies. What are their structures? So, for example, the first parasite to talk about is Entamoeba histolytica. Entamoeba histolytica, you will be looking at what is its shape. It has got a trophozoite, the oocyst, the cyst. So, and you have got a lot of parasites, and for each of them, you need to know their morphologies. So it will be a bit confusing which one is supposed to have an oocyst. Others are going to have only a cyst without oocyst. So which one has got a oocyst? Which one has got a cyst? Which one doesn't have this? There will be those comparisons and there will be a lot. So the best is you start early and you are arranging them in order. So on our drive for microbiology, we've made sure that we've put these things in a proper order. We'll first put parasitology, and then for the parasitology, because it's also broken down into those components, so we're also going to break it down into their components, so that it just be easy for you to be able to follow them. This course is very, very long. It's actually the longest course, and it's a very bad course because of that. So you need to make sure that you have got a systemic way of you being able to arrange the data. You now go to the bacterias, you'll be looking at the bacterias. They are also not few, they are a lot. And then you're going to have mycology, looking at fungi and virology. After you do these topics, you also now start doing general topics. Like, for example, you'll be looking at infective endocarditis, you'll be looking at meningitis, general. After you've looked at all the parasites, all the bacteria, all these, and then you start looking at the general topics now, that the parasites and the bacteria that we talked about to be able to cause the general infections that will be able to cause. But in the same way, when you are talking about the parasites themselves, you are also talking about what they cause. Example, Entamoeba histolytica causes dysentery, amoebic dysentery. You'll be talking about acanthamoeba. What does it cause? So next week we are starting to learn. You will see just the first parasite. The first parasites you'll be talking about, you're going to have what we call Negleria fowleri. And in head and neck, you will see that that thing is when you are swimming, it will be able to enter your nose and then it will cause problems in your central nervous system. So they'll make sense, don't worry. So please take note that it's a very long course. So you want to familiarize yourself with exam questions. Go through past papers, past papers, past papers. And we've solved again a lot of past papers. So you guys will be able to enjoy very much because they basically repeat questions. Even when they don't repeat questions, at least the questions are in the same vein. So it won't be too bad. We've solved all the tests for last year because we're going to have test one, test two, and test three. Test one will be parasitology, which is the longest component. Test two, they mostly combine bacteriology and mycology. Test three will be virology. So we have all those tests already solved, both in PDF and in videos, and also the previous exams. So you want also to know some topics that you can't leave out. But the problem is that these people sometimes they will disappoint you because there's some topics that you're supposed to know, topics like malaria, topics like HIV. And in these other tests, in the test they can bring them like that. In the final exam, you find there's not even a question on those high-yield topics. But then you get to see as we get to go that as you interact with this information, you'll be able to know how to carry them out. And it will not be too bad because at least you'll be interacting with people that have gone ahead and how they've managed to be able to compress this data so it will be interesting. Is there any question on microbiology? Any question on microbiology? Okay. So the next course on is neurosciences, and the doctor that will be teaching us neurosciences is also here, Dr. Victor Musaila. For neurosciences, I think we are going to divide this course among ourselves so that we match effectively because it's a long course. You are going to have four components. Actually, when you start learning, you'll be learning head and neck. This is basically HAN anatomy 2220, the same one you are doing. Be doing head and neck. After you finish head and neck in 1 month, you write your practical test and your test one, and then you now start learning. Yes, please. Okay, so after you finish your head and neck, that's when you start learning the neurosciences. Please go on if there's a question, you can be free. Okay. So please, as we start, so next week I've said that next week we'll start learning this. So the problem is that the head and neck is also long, right? And you learn it in 1 month and write the tests and the practical and the theory. So if you don't start it early, it will be a bit frustrating because there are a lot of things to know. Trust me, the head, just the head itself, if you just get the mandible alone, there is data you need to know. That's why you need to have time, okay, to be able to learn it properly. You look at the high yields and the things to be able to remember. I'll probably be teaching neuropharmacology, connecting with the pharmacology or our doctors because we have got some two other doctors who will also be taking us in neurosciences, Dr. Kletas Monsa and Dr. Victor Msaila. So we might split. You might find that we might be interacting with you. I might be coming in some physiology topics, in pharmacology topics. Our doctors also can take up those so that we just make the course effective. Because even when you be learning neuroanatomy, to be the anatomy people will be teaching Dr. Mukape, Dr. Banda, those doctors. Physiology, it will be the physiology doctors who will be teaching it. Pharmacology, it will be the same pharmacology doctors will be teaching like Dr. Chidumayo. So for her, more likely she will come and teach you the first topic, which is pain and pain management. So you want to make sure that you know a topic. You know she's Dr. Chidumayo. So again, back to our link, the same questions that are there are the questions that you bring in the test and in the exam. You also have Dr. Mwanza likely to come and teach you some topics. So for him, there are also some topics he teaches neuropharmacology. There are some topics, some links that you have to be familiar with also. That he just gets the questions there and then you start answering like that. So you want to also take note of those. Okay. There are pathways that you are going to start with pathways in anatomy, the ascending and descending pathways. I even heard that you people learned ascending and descending pathways in second year. I wonder what happened. So you break them those in details, and you can't go in neuroscience without knowing the pathways and the diseases that affect there. So that's high yield. And you should be able to differentiate physiology topics from anatomy topics as you get to answer questions. For example, you talk about the ear in physiology and in anatomy. In anatomy, you're interested in talking about structure and the general body parts. In physiology, you're interested in looking at the molecular mechanism. How do you hear? How do you hear? So go back to the molecular mechanism. What are the ions involved in hearing? So that's what you want to know. So there are some must know topics that we'll be mentioning, but one of them is Parkinson's disease. It's a must know topic. It's a must know. It's actually going to be much in pharmacology. pharmacology. You also discuss it in physiology when you talk about what's known as the basal ganglia. You also talk about it in anatomy. Basically, Parkinson's disease, would discuss it in all the three components of neuroscience. It's a high yield topic. Yeah. Is there any question on neurosciences? Okay. So let me ask my doctors that will be taking us in these courses to say something. We can start with Dr. Isha with pathology. If okay, thank you so much, Dr. Isha. And just some advice as you handle these courses. More of the study tips will be giving them topically because each topic has got a way in which you're supposed to handle it if you want to get it to the core. So the information might not be general for everything. So as we get to take you in each topic, we'll be able to give also study tips on each topic. But there's a specific things that are high yield on each topic that you want to take note of. Because you'll see if you start learning, let's say for example, the reproductive system, you'll find the entire reproductive system, they barely pay attention to cervical cancer. So you would have wasted all because the reproductive system is very long, like in pathology. But the highest yield is cervical cancer. So you want to be able to understand how you which one to pay attention to, and each course has got a way in which you're supposed to handle it. Past papers very good. Yeah, some of the courses require, as we've mentioned already, you understanding or knowing the source of the questions. Of course, we know the sources, so will be easily bringing them out for you to be able to use them. And when it comes to handling pressure, you'll be doing a lot of things at the same time. So just make sure that you are not overtaken. And let me first have Dr. Isha to say something about how you can be able to handle pressure with all these courses, which are a lot, and it's become end on his end. So basically, as mentioned, the important things that we have to know. Study groups are vital. You are going to share a lot of information there. Some things, trust me, you just hear it on the study group and not again. So please, if you can form study groups, make sure that you form them. But that doesn't mean that if you're not in a study group, you'll not be effective. I tried to have a study group and it didn't work. I stopped it. And I didn't have any other study group later after that. Because people became unserious, you are begging them. So I stopped it and we just did maybe the beginning of the year a bit like that. And so I didn't use much of the study group. I did it myself. So if a study group is not effective, don't be there. It will waste your time. It will put you in an unnecessary pressure. And please always remember to, when you hear where people are bringing out data, listen some to the data that is coming out. If possible, get wired. It's very important. It will help you know what to pay attention to the most, right? See, possibly if you can ask seniors to ask you questions. Can you ask me a question on this? Okay, I've studied this topic. Can you ask me a question? It will help you to see if you have really studied that topic or not. So you don't want to be running away from seniors if they want to ask you questions. They don't mean to make you feel ashamed or something. They just so that you can be aware of what you expect. That's how some of us manage to be able to pass these test ones. You just hear they are wiring them. Ha- so even that question they can bring. And after that, I went through, and those are the same things that came in the test. And you are moving where you are so busy and you are not failing. Why are you not failing if you are very busy? It's because my ears are listening to the most important things. So please make sure that you do that. I think that is that for now. That is important for us to take note. The other important things we'll be able to talk about them as we get to go